Social workers are so important for unpaid carers. They provide support, advice and information that helps unpaid carers to provide care to their loved ones while at the same time looking after their own needs and well-being. We want interactions between unpaid carers and social workers to be the best they can be. Over the last year, Carers Wales, a national charity for unpaid carers, has been working on a Welsh Government-funded project called Carer Aware. The aim of the project is to transform carer recognition, respect and support across health and social care settings in Wales. We held 10 focus groups for both social workers and carers from all parts of Wales. Their experiences helped us co-produce a set of good practice principles and practical tips for social workers with the aim of improving understanding, developing mutual respect and creating more positive outcomes for all involved. A matching set of principles has also been developed for carers. Every stage of this project has been shaped by social workers and carers. So what good practice principles did carers and social workers create together? Firstly, as a social care professional, you will be aware of the legal rights of carers to assessment and support, as set out in the Social Services and Wellbeing Act 2014. You should therefore be confident about what a carer's needs assessment or a what matters conversation is and why they are worthwhile. As a social worker, you should use your skills and experiences to learn about the carer's situation while recognising that they are experts by experience in relation to the person they care for. Carers should have their preferences and opinions meaningfully taken into account by social workers. Your conversations with them must be based on a carer's legal right to have a voice, choices and control over their own caring situation. You should understand that a carer's needs and responsibilities may fluctuate over time, depending on their situation. You should also take into consideration the health and safety aspects of the tasks carers perform. A paid care worker undertaking similar tasks would have their health and safety needs addressed, and carers should as well. You should seek to understand the different agencies and services available locally and ensure that information is shared so carers don't have to repeatedly explain their situation to every service they engage with. Many carers will also really appreciate it if social workers could help them to use the information you have provided them with, such as by helping them to make an application for support or contact a service they've been signposted to. Both carers and social workers agreed that social workers should be culturally aware, seeking to understand how cultural factors can shape attitudes to caring and influence the appropriateness of services. As social care experts, you should also be disability aware and avoid making assumptions about a disabled person's capabilities. You should communicate with carers in a clear and reassuring manner, keep in touch with them in a timely fashion, and notify them of any staffing changes at the earliest opportunity so that their contacts can be as consistent as possible. Finally, social workers should be open with carers about the constraints they work with, the decision-making process, and why a decision has been made. You should provide the carer with feedback as soon as possible and keep in touch with them so they are kept informed on the outcome of the process and can assess their next steps. So, how can we incorporate these principles in everyday practice? Here's a few examples. Before conducting a carer's needs assessment, read up on notes about their case to understand their situation. Ask the carer when and where would be best to conduct the assessment, and make sure they're offered a separate assessment in their own right. Try and make sure there's plenty of time to do a thorough assessment, and offer to do the assessment over more than one appointment if they'd prefer that. In line with the legislation, the assessment must cover whether a carer is able and willing to provide or continue providing care. Assessments should also consider the outcomes a carer wishes to achieve, so ask if they're in employment, how they're balancing work and care, or if they're looking to begin education or training. Consider whether they may need expert financial or welfare benefit advice and where they can access help with making claims. You should also discuss whether the carer has a contingency plan in place should there be an emergency and they were unable to care, and if not, work with them to develop one. Carers will appreciate it if you're honest and realistic about the support they may be able to access, and always give them a summary of the assessment afterwards. If you're supporting a family through the transition from children to adult services, help the family understand the process and the agencies involved, include the young person and the family in the planning process, and give them as much consistency in terms of contacts as possible. A loved one being discharged from hospital can have a profound effect on a carer. When you are involved with hospital discharge, try to ensure that the carer is identified at the earliest opportunity and that they are involved from the outset in the discharge planning process. You should explain the kind of tasks a carer may be about to take on, but try to avoid medical jargon and offer them a new assessment of their needs before discharge takes place. Carers may need help with end-of-life care planning and support during the process. They should be offered a carer's needs assessment with regular reviews as the situation develops, and advanced planning should be considered so the wishes of the cared for person and the feelings of the carer can be recorded. This video has given an overview of our good practice principles and practical tips for social workers. We'll be expanding upon this in the free training we are offering for social workers across Wales through this project. To sign up to upcoming training sessions, access useful resources, including the principles and tips in full, or just to learn more about the Carer Aware project, please visit the link in the description box below or contact Carers Wales. Our contact details are in the description box. Thank you.